I call myself integrative because I'm board certified as a family nurse practitioner. I'm board certified in holistic and integrative health through Arizona State when I was getting my doctorate, because my doctoral dissertation is on integrative techniques and mindful techniques for healthcare professionals and anxiety reduction. And I also now am currently in studies in the Institute for Functional Medicine. So overall, how I came to where I'm at, what's a traditional way of being in the nursing field, and then what would be considered where I kind of went. My path was a little bit different. My story was a little different than the average. Since you guys are already in school, hopefully kind of you're in the direction of kind of transitioning and getting into colleges and stuff. The greatest thing about medicine is that there's so many different fields, whether it's nursing, physical therapy, being a doctor, being a surgeon, there's so many different aspects in the medical field. So for me, I am what they call a nurse practitioner, and we're going to just kind of go over that. So what is a nurse practitioner? Have you guys heard of nurse practitioners before?
Yeah.
Overall? Okay. So the field is, I'm board certified so there's different types of nurse practitioners. Oops, let me go back. There's different types of nurse practitioners, but a nurse practitioner is a certified clinician. We treat health conditions, and we emphasize on a lot of disease prevention, health management, whole health. NPs are really comprehensive on the whole patient and a lot about patient-centered care. The difference between a nurse practitioner and some of the doctoral medical model, nothing wrong. They're very important each. They work kind of hand in hand. We just kind of, because we're nurses first, we start out as registered nurses. We kind of have a lot of the patient care model very centered. So it just is a little bit different in the way we treat patients. But overall, the greatest part about it is, we help hand in hand with doctors and the interdisciplinary team, because we can help our patients by diagnosing, prescribing medicine, treating illness. We do screenings, we educate, help with referrals. We work a lot with other specialists to kind of get, like the patient needs to go to a cardiologist, and they need to go to different specialists because, things may come up in their blood work. We work hand in hand. Benefits are, we try to always, the greatest thing about the field of nursing that I love, just like in the medical field, we have a really good board of standards. So our board of nursing and the National Nurse Practitioner Association, we have such large accreditations and backing from a large group that we are, from healthcare policies all the way down to, laws in the state. Especially even with this COVID, you might have seen that the Deputy Surgeon General was actually a nurse practitioner, the National Deputy Surgeon General. So they're in the field in so many areas. Nurse practitioners and nurses can be all over. We help lower the costs, because a lot of nurse practitioners kind of take the role of not being always in the hospital necessarily, but kind of in the communities and different areas, and just kind of being an extra outlet for patients. And we are really big on patient satisfaction and overall care. So here's kind of the traditional role of what it would be like as for you guys. Like, so usually if you're going to go become a nurse practitioner, you would do some volunteering in a medical area, either be an EMT, might work in like an office, and try to get a feel of what kind of different areas of medicine you might like, whether it's becoming a doctor, a nurse practitioner, radiology, so many different areas. And then you kind of would do that. Then you would start applying for an accredited nursing program if you were going to go into becoming a nurse practitioner. You may graduate your high school, you take 4 years of nursing, And then it goes into the route of like 2 to 3 years of work. Then you start applying to a master's program. And then if you are interested, you would then go for doctoral prepare. So this is from the association that I was certified from, and it's called the American Association of Nurse Practitioners. So it is similar to the road I was stating, but basically the pathway of what I had to go through was, or for you guys, is you get your bachelor's or your associates, and then you have to pass a national board exam. And then from that, then you would be working in your field, in your specialty, and then you would decide where would you like to get your master's. So then you then have to apply for a master's program, and work and decide maybe you might do an additional doctoral program, or you have to have a certain amount of hours in the specialty area. And then again, you would have to test and be board certified to be licensed. It's a pretty, shall I say, lot of work. But, if you like what you do, don't give up. So I'm going to say, for my reasons in why I became a nurse practitioner, a little different than the average person. Not that it was anything bad, or I just didn't follow the normal path that I just showed you. So the traditional path, like you go to school, you do your thing, and you go through. For me, it was a little bit more difficult. Not in a bad way, I guess. My challenges and my failures and things that I had to overcome made me better. So my why in nursing, and always have a why in a sense, find a purpose, because to be in medicine and in healthcare, you have to not just care about your patients, you have to care about yourself. You have to love what you do, because some days are very long and can be tiring, but you've got to have a passion in a way for it. So for me, my story was, I was premature when I'm 2.5 pounds. I had a lot of nutritional deficiencies. I was adopted, and my birth mom was non-speaking. She only spoke Spanish, Hispanic Black woman. And I was adopted into a family, and a good family, but I ended up being with a slight learning disability. I ended up being audio visual kind of person. I had to learn. I was smart. I had a good IQ, but I had to learn a different way to figure out how to get through my path. And everybody has a different journey. My timeline, as you'll see, is a lot different than what we were just discussing. That doesn't mean, like, for you guys, whatever, if you guys end up doing your 4 years and then you go 4 years, that's awesome. Whatever works for you, but always keep learning. The one thing about my journey is that I never stopped learning, and I still, to this day, as you see, studying functional medicine now, I never stop learning, and always know that there's something in life that we could learn and be a part of and have a passion with. So for me, in my timeline, I'm a military veteran. So I am a woman that was in during 9/11, and I spent most of my early years, if you guys go to college, those early years I actually spent when I was in the service. And I was able to use that time for a GI Bill. I then took that time to just kind of change my mindset. And for me, I also realized that I wanted to make a difference. I didn't know exactly where that was going to be in my medical field, but I knew it was going to be something. Excuse me. I love taking care of patients. Overall, I love the being more mindset, holistic. And for me, nursing was that model of care, but you'll see I was in nursing since the beginning, and it kind of transitioned for me to be a nurse practitioner. And whatever kind of medicine, like I said here, please love what you do, because it's a lot of work. It takes a lot of studying. It takes a lot of determination, and it's an ongoing process, because you're going to have good and bad days. So my journey was, like I had said to you guys, I was in the military, and I was in during 9/11. I became military trauma trained. So when I deployed, I was able to help sailors and other colleagues of mine during injury. And I actually had on one of my second deployments actually got injured, and I had to kind of, go through that and get through that time. And for me, my transition as I was getting out of the service, the training that I had, I was able to get an LPN degree diploma very quickly. So that kind of became the easiest transition for me. I had to start working. So that was something. Now, that's not an average thing. So, I went an LPN route, then I was an RN. Then in 2011 became BSN and MSN, and eventually I, got my doctoral degree. And then these other board certifications came when I did my integrative health, and I became a nurse practitioner. So for me, the journey was always ongoing. And that doesn't mean that maybe for you guys, you may be able to finish your schooling quicker than others. You may do something different. But for me, I had to find something that I really enjoy doing. And when I started in nursing, I realized that kind of was my path. And it was more of the care and the way I like to think. But medicine was something I definitely actually had applied to MCATs and studied for that. And I was in debate on where I was going to go, but I knew that kind of nursing probably was where my transition was, being that I had started in that area as an RN. But I love it. It has its good days and bad days. It can be tough. Sometimes when I started as an LPN and an RN, my days were really long. And then sometimes now as a nurse practitioner, it got really long. But now I've kind of made a little bit more of my where I want to do. So it's a little bit easier in a sense, in a matter of sense. My additional board certifications in the integrative health and then eventually in functional medicine, I started to do those because it helped with, I realized I wanted to do additional studies to not just prescribe medications. I was really about lifestyle modifications and other avenues for my patients. So it helped me. So I wanted to help others in that way. So where do I work in family health? There's so many different types of nurse practitioners. So there's not just family medicine. I'm in family medicine and health, so I do family and integrative. But there's a lot of other areas that nurse practitioners can be in. They can be in acute care. They work in the hospital and they get specialized in the area there. They can be in the community, which I do community work and family. They can do neonatal pediatrics, kind of just like a doctor has a specialty. A family nurse practitioner, a nurse practitioner also has to specialize. You can't just say, I'm going to do everything. You have to really hone in. So I'm more of an outpatient provider and primary care. I also have done a lot of digital health. So where do I work? I am certified and licensed as a registered nurse and nurse practitioner in New Jersey, New York, Florida, California, and Texas. The reason I have multiple licenses is because I work in the telehealth digital health field in addition to my local market in New Jersey. So I can see patients in all of these states that I'm licensed in with my own company, like I just a small company, and then also just with another. So people will hire me through different digital companies or health consulting. I also had worked out with Google a few years back doing Google Health. They used to have a Google Help Out. Now they're going to be doing stuff with the Fitbit. I don't know if you guys have seen that the Fitbit is it was bought by Google. I don't know if you guys are into that, but I'll tell you about it later. Well, sometimes I'll do health consulting. So agencies, I do work for an agency and I've done some primary care work, urgent care work, and ER triage. And then, like I said, I do digital health work, and I work with one company right now called Wheel, and they hire me to work with many. So basically, there's all these digital companies now, especially now with the pandemic. You can get a doctor, nurse practitioner at anywhere from anywhere. So like one big company is like Teladoc. I work with a doing asynchronous and robotic kind of groups, and basically they hire providers to do care there. So it's just another way of using my skills in another area. I have also worked in community care settings. Like if you guys are from Rutgers, I've worked in Newark and done a lot of work there. Okay. So overall, the reason I call myself an integrative nurse practitioner and family health is because I work specifically on the whole health and not just disease process and disease management. I'm more about a holistic approach. I think more in the mind, body, spirit medicine. So for me, it is not just about the diabetes. It's a lot about like a lifestyle management. I look very much so into not just the heart disease and the cholesterol. I look at the whole picture of what are stress triggers, what are things that are going on with their diet, what are things that are going on with their life at this moment. There's a wellness approach. It's just taking it a little extensive than just one fix. So it's kind of in the lifestyle management, stress transformation instead of stress management. I try to transform people into thinking differently about how things are affecting them, because stress is actually good and bad. A lot of chronic care management, when you're thinking outpatient, you're working a lot with patients that are trying to work on their hypertension, diabetes, cholesterol, overall chronic diseases. And then also, I work also to help others with, just getting up to date on their screenings, making sure that they're kind of looking into pap smears, colonoscopy, routine labs, pain management. Sometimes it's just coordinating with other providers and specialists to make sure that the patients are kind of keeping up with their schedules. Sometimes it's with tobacco cessation, alcohol cessation, getting them to kind of get into the right mindset. And, and as basic as medication refill, someone might just need a medication refill, but that's kind of a time that I take to like re-educate, re-inform them about what's going on, have them talk to me, really be an active listener and give them the opportunity to kind of see if there's something else going on. Maybe that's the time when they say more or less to me, and I try to give them that time and space. So recently, since the pandemic and COVID, my hours are a little different. I would say my first wake up and day is like I wake up, and like I was telling you guys, I'm more about trying to be holistic and I work from the inside out in the sense. So for me, I wake up, I do either a little meditation, journal, or gentle breathing. And for me, that's just kind of a way of centering my day to get through. 6:30, I get my water and my coffee. If you ever follow me ever anytime, I'm always with like a gallon of water. With my electrolytes, and then I get a little small cup of coffee. 7 a.m. I have a little one, so I got to get up and do that. Now, this timeline and day in the life is a lot different than it was about 6 to 8 months ago, when I was more in the hospital, or like at urgent cares. That was more of a 12-hour day, and it was a lot of longer days. This one's a little bit more flexible because I do digital health and small office. So at 8 a.m., I'll look at my digital online visits, see if they're synchronous or asynchronous. And what that means is synchronous means that they're video calls that are like, how you and I are talking right now and you guys see me. That's called a synchronous call. And asynchronous would be, I would look at charts and look and overview patients without them being online directly. And then other times I'll see what patients I have in office. The 9 a.m. would be maybe I would see them in office, or 9:30 or so. The days are a little bit quieter per se, but I still do have a lot of paperwork. 10 a.m. I bring in a protein shake, and I said that there just because in the medical field, there's sometimes you don't always have time for food. So I always say try to bring some sort of protein or available food intake for you, because what happens is we eat really poorly in the medical field, like as practitioners, because we don't give ourselves enough time because we're always worried about taking care of others. So really take care of yourself too, especially, I know it's studying and you guys are students. It is always hard to kind of give yourself that extra time. And then around 12:30, sometimes I'll get the lunch, sometimes I won't. If I'm in an urgent care ER setting, it doesn't always happen. 2 p.m., I try to like review charts or upcoming appointments, labs, screenings. I'll look over faxes and things. Maybe I have to do refills at that time. I do more televisits or patient visits. And around 4:30, 5 o'clock, I will sometimes complete the day. I have also done house visits or home visits. So sometimes between 3 to 6 o'clock, I'll go do those house calls. And then I give access to some of my patients. I have a office text messaging, so people can access me on text message. And then for the most part, I put my little one to bed, and then I still kind of do a little bit more work in the evening, but I try to kind of tone it down after that. And then, I get myself ready to rest and reset for the next day. Now, this is definitely a different day in the life than it used to be. My ER and urgent cares were a lot more 12-hour days. They would be more like getting up to drive to work at 6 a.m. and then starting work at 7. And I wouldn't finish until 7. As an RN and urgent care and NP model, usually I'm 7 to 7 or 9 to 9. So those definitely this timeline does change. COVID has helped a little bit in some aspects, but I definitely have more work on the computer and online and just extra phone calls. I'm doing a lot of consulting and phone calls now. I have cases, but that might be a little bit much. So do you guys, you might not want to go over that right now. Or do you have questions at this time? Hi.
Could you go over one of your cases at least?
You want me to go over one? Okay, I
Yeah.
can do that. I just didn't know if you guys wanted to do that or not.
Yeah, I'd like to see it.
You like to see it? Okay, cool. All right.
Thanks.
So, all right. Let's just look at one. So it's not a too complicated one. So basically I had 3 cases that I was doing, and the 3 cases were because I work in different areas, right? So I work in a telehealth video call, like you and we're talking on the phone. You see me in my house and I would see you in your home. So it's one case. Another case is in an urgent care. So in an urgent care, I have more diagnostic tools available to me to be able to do certain things. And then in the office, I have different diagnostic tools available. The main thing about all of these cases is that I tell you is that you still have to know what it is to be a provider, and you still have to be knowledgeable in your fields and in what is going on with your patients. And you have to have a good history and a good overall view of what's going on for your patient. So you want to be knowledgeable and okay with, I would never recommend in your first year doing televisits for patients until you have a really good grasp of what it's like to see them in person, because you really want, before you make decisions, you don't want to do anything without, because I have to test for a lot more things. And if I'm unfamiliar with what's going on, I wouldn't want to make a mistake or miss something. But in this first case, it's not, it's a fairly routine kind of visit. So in this first case, I had a 41-year-old female. Her chief complaint was she just had really bad headache. She had some face pain, nasal decongestant for the past 7 days. So what I do is in a video call is similar to when I talk to someone in an office, but the difference is instead of me going over and touching her face and looking over. I try to have her come close to a video. I have her tell me, like, we're talking about her face pain, and I say, does this hurt? Tell me here, touch here. Does this hurt? Tell me here, does that? And so I do a physical in this video call, and I would do the things that I would have done in an office, but I'm using her as her, letting me know. Now, granted that I can't do everything, it definitely limits me, but I try to do the best that I can. And if I don't know, then I will test out. I will get ultrasounds, I will get x-rays, I will get blood work, I will put for EKG, I will get, or I will send out to something further if I can't manage it. So there's a line that telemedicine can do, but if I have the diagnostic tools for her, then I can, do more. So in this case, I'd had her check her, tapped her facial, ethmoid, and maxillary, and she said they were painful. She tried to use some Tylenol, some over-the-counter medications, but they weren't working well. Overall, her pain scale. So there's different, depending upon the scales that you use, there is usually asks for pain, pressure, obstruction, discharge, and smell sensation. You got to remember now, we're in COVID time. So this is very similar to COVID symptoms. So before this, I would have never had to say, a year ago, I would have not been like, well, you need to get a COVID test. But these symptoms are still similar to COVID. Having trouble breathing, do you have smell sensation? For this patient, she did not have COVID, so I'm telling you that right off the bat. But in the scenario, I still have to have her get tested for COVID because that's something that's come up now. Now, her pain was 5 out of 10. Oh, sorry. Her pain was 5 out of 10. The pressure in her maxillary, which is her jaw area, ethmoid, was painful. And she was having trouble breathing because her nose was congested. The discharge was intermittent, meaning like she would have sometimes a little bit of discharge but not discoloration. And her smell sensation was minimal. And that smell sensation is that one where that could happen in a lot of different diagnoses. Her vitals were kind of unremarkable: 132/74, 98, no fever, pulse was 72. So in this case, it's a very common treatment. She had acute, I don't know, you guys don't go over cases overall, right? No, not yet. It's okay. But overall, this is a pretty basic, simple case. It's just called sinusitis. So it's inflammation of the sinuses. So in this area, there's different cavities. So in the maxillary is usually where they'll get jaw pain. And in this area here, because of the nasal passages, they swell up and they inflame. And itis means inflammation. And the sinus cavity specifically is either it doesn't always have pus, but it will have liquid and mucus. And that can be accumulation from dust. It can be accumulation from a pustule or infection, or it can be even fungal or just foreign body. In this case, it was just a basic bacterial, but she was a simple sinus treatment. Now, what I usually do for that treatment for her, being that I do both a pharmacological and I also do non-pharmacological treatments, I try to work with the patient. Now, initially, because it's also a televisit, if the patient had been with this for a few days and longer than 7 days, then I usually will try an antibiotic treatment. If it's been less than 7 days, I will not go for an antibiotic treatment. I will initially start them on a nasal spray. First, have them do nasal irrigation, like a saline, and clean out the area, kind of get rid of whatever maybe things may be, and do a steam shower for opening up the nasal passages. Magnesium is an over-the-counter vasodilator. It's also very good for kind of opening up, and just a slight, I might prescribe that. And then medication-wise, I would probably just do a Flonase which is a corticosteroid. I would do that as an option twice a day before I would prescribe an antibiotic. But in this case, being that she was over 7 days with the illness, I did prescribe her Augmentin, which is amoxicillin clavinate, for twice a day for 7 days. And then I had her follow up with me to make sure that the course of treatment was correct. Does anyone have any questions on this case or just in general so far? No? Oh my goodness. You guys are so quiet. Oh, all right. Do you have anything you guys want to add or anything you want to talk about right now? You guys just totally quiet.
I just wanted to say that this was really like nice. I really enjoyed it. But I just wanted to tell you that we only have like less than a minute left.